Alright, so pretty much, do you have any questions?
Actually, I do have a couple questions I was thinking of when you were talking. I know you showed me a picture of a boil, and I guess, like, what would I do if I had a boil? What's the steps I should take?
Okay, so normally you shouldn't be alarmed. It will, like we were discussing, will resolve on its own. Usually it'll just drain out and, it'll go away on its own. But if over time it doesn't, if it's been a week or 2 weeks and it hasn't gone away, I would go see a doctor. And sometimes, and what they'll do is they can aspirate it or take some of the fluid out. It's the same thing. And they can culture it to see if it is a Staph aureus infection. And they'll give you an antibiotic, most likely, oral antibiotic. They'll also possibly use, they'll drain it, to get rid of the pus. Another thing is if you notice that it's not going away and it's spreading, it's also indicative that it could be an infection, bacterial infection, and not just like a pimple or something, because you never know. I mean,
What do you mean spreading? Like it's getting bigger, or you have more?
Either one. I mean, if the redness is spreading or if you have more of them, then yeah, that would be indicative that it's probably an infection or something like that. So I would go to your doctor and make sure that you have it checked out.
Okay, the other question I have is about toxic shock syndrome. I know I've heard of it, but I was just wondering why it's less common.
So one of the major things is information. I mean, it is key when it comes to these sorts of things. Back, 20 years ago, they came out with a tampon that would hold more during a period, and that's where the problem lied. It was that that a woman would have the tampon in longer. So normally you would replace it after a certain amount of time. These women would put it in and leave it in there for way too long, and it would cause bacteria to pretty much grow like around it. So as they found out that this was the problem, this is what was most likely causing toxic shock syndrome, the manufacturer recalled it, and now women, see it in every tampon box, the possibility of toxic shock syndrome. So information is definitely key to preventing it from, becoming an epidemic like it was 20, 30 years ago.
But how would I know if I had toxic shock syndrome?
So I mean, you're a healthy person. I mean, some of the symptoms is you would have a really high fever. You would have low blood pressure. You could even go into shock. So I mean, it's not normal for a person who's healthy to experience these sorts of things. I mean, it's really high fever. You would need emergent medical help, because you would
Okay, the other thing I was wondering about was the scalded skin syndrome. You were saying that appears in children, and I know a lot of times children can't have certain medications. Is there a different approach to how they treat it in children, or is it the same as they do in adults?
Well, scalded skin syndrome is predominantly found to occur in children. They would use antibiotics since it's a child or a neonate, a younger infant. They would use a lower dose according to weight and what evidence-based medicine has shown to work. So the antibiotics would be less. But another thing that they would also do with scalded skin syndrome is to make sure to keep them hydrated, because their skin is drying out and it's pretty much coming apart. So it's very important that they're kept hydrated during this whole syndrome. So that's pretty much what occurs with scalded skin syndrome. Okay, so now let's discuss how they diagnose Staph aureus infections. So what they use blood agar, which is a type of medium that they use to grow the bacteria on. So pretty much they get the Staph aureus from a lesion, and then so they'll take it out of, like, let's say a boil, and they'll put it on blood agar. They'll leave it overnight. So after 24 hours, they can do a simple catalase and coagulase test, and then they'll see that if it is Staph aureus or if it's something else completely. Because as we were discussing earlier, Staph aureus is catalase positive and coagulase positive, and the coagulase part is the most important because it's distinct to Staph aureus. However, sometimes it's not as easy as a simple superficial skin problem. Sometimes there are deep infections when it gets into the blood. So for deeper infections, sometimes they'll use blood culture. So they'll, if you have bacteremia, which I described earlier as the bacteria getting into your blood, they'll do a blood culture, and they can use that to diagnose if it's Staph aureus or not. And specifically in osteomyelitis, what we were talking about earlier, and endocarditis, and that's pretty much the lining of the heart. If they do a blood culture, they have to use that to identify Staph aureus infection, at least in those two conditions. So now some of the treatment for Staph aureus infections. Like we were discussing, it's pretty much self-terminating. Most Staph aureus infections will resolve on their own, and it's especially true for superficial infections like we were discussing earlier. Antibiotics that they use when it doesn't go away, like we were when you asked me about a boil that doesn't go away, they'll use a penicillin or one of its derivatives, one of first, second, or third generation, and I'd go over the doses with you, but it's a little bit past what you would need to know for your test or for any person to really understand it. But if it's methicillin resistant, if it's MRSA, then it's usually vancomycin that they'll use instead of penicillin, because that is the drug of choice, as a lot of studies have shown. And again, the way they figure out if it is methicillin resistant is they could grow it on a media, and they could do a test where it'll see which antibiotic. They'll use little discs and find out if the antibiotic will prevent it from growing. So they'll put it on the agar, and then they'll put the little discs with antibiotic on, that's dipped in antibiotic, and they'll see if the bacteria will still grow next to the disc. If it does grow around the methicillin disc, then obviously it's methicillin resistant, and they'll see if any of the other ones are do actually inhibit its growth. So that's very important to find out if it is methicillin resistant. Now I want to show you a video. So we were watching news stories about MRSA and its prevalence in society, and it seemed like it's very negative, but now we have some healthcare professionals who give really good idea of how you can prevent it, what MRSA is, what we should know, and this will really help you for your exam and if you ever wanted to explain it to somebody else. So let me show you this video.
MRSA stands for methicillin-resistant Staphylococcal aureus. It's basically a type of bacteria. Now, the staph family of bacteria has been around forever. It's a microbe that's in the air. We carry it on our skin, but it's never been this deadly or this disabling. In other words, what we think has happened is what commonly happens to some bacteria. It even happens to the AIDS-causing virus, which is called mutation, and that means parts of the bacteria change to withstand the things that we're throwing at it. For example, antibiotics. So the antibiotics which would have killed the regular Staph aureus, the MRSA Staph aureus is resistant to it because the part that was susceptible to that antibiotic has mutated, and now what's happened is the bacteria, just as a Darwinian mechanism of survival of the fittest, it's changed to withstand that insult. So it's become more and more difficult to treat. That's the first problem with SRA and why we're hearing so much about it. The second problem is it's migrated. It used to be found mostly in hospitals. Now it's being found in the community, and it's affecting people we know. It's affecting people who we would have thought would have been the most healthiest of all. Athletes in school, youth, children of younger ages, and that's very, very alarming. There's always the problem of how you can spread a bacteria. So what we do is we talk about preventive measures as a way to stop the spread of bacteria, not only with one individual person and the different parts of the person's body, including the most susceptible parts, but also from person to person. This bacteria, MRSA, is a bacteria that is spread through skin, and skin contact, as well as contact with equipments or in other situations where the bacteria is able to multiply. And those are usually warm, moist, wet, damp situations, such as in whirlpools, in showers. The bacteria can also be transmitted on towels, in locker rooms, places where people are in close quarters and possibly can have that skin-to-skin contact, like dormitories, like prisons, like army barracks. Places like that are all places where this bacteria can find a home and then jump from person to person, either from skin to skin or through the use of some kind of equipment. The reason MRSA has now flown above the radar is because not only is it so resistant to antibiotics that we have, so that we have to use a combination of antibiotics or our most potent, strongest antibiotic, but it has the ability to mutate again. Let's just say somebody had MRSA and we treated them with our shotgun approach, our most potent, most powerful antibiotic that we have. Let's say that person was inadequately treated, not treated long enough, or treated with the incorrect low dose of antibiotic. That particular bacteria then has the potential to mutate again, become resistant to what we would consider the most powerful tool in our arsenal, that particular antibiotic. And right now we continue to develop newer and newer generations of antibiotics, but right now we have to treat MRSA with what we think is the most powerful antibiotic. If that particular bacteria mutates against that, then basically we don't have any tools in our arsenal to treat it with. One of the problems with MRSA is because it can look like a regular cut, it can look like a regular pimple, it can even look like a small boil. The people tend not to pay attention to it. They tend to think, oh, it'll just go away, or treat it maybe with topical over-the-counter medications. The most important thing is to watch a lesion very carefully. If it seems to progress, to have a lower index of suspicion and to go in to see the doctor, even though you might think it's nothing, particularly if it A, changes and gets worse, or doesn't improve. Those are the two hallmarks that we look at. And so what we need to do is, what we are doing now with all this publicity, is raising the level of awareness. This thing is out there. It can look like something that you should not be concerned about, but in fact, if it changes and gets worse or doesn't improve, please go and get some attention paid to it, because it could be something that you can treat at the very early stages. Now, it can affect the skin, it can affect joints, and at the very deadliest, it can invade the body, affect the bloodstream, and then travel through the organs. We would like to stop it when it affects the skin, because it is primarily a skin infection. It enters the body through cuts in the skin. When we lose the integrity of the skin, it can be a cut, scrape, anything where the skin is no longer the barrier that it is to other organisms. So that's the most important thing. Have a lower index of suspicion if you see something. Monitor it carefully. Go in to see the doctor. Now we can talk about preventive measures as well, and that would be, believe it or not, Mom's old advice, good old-fashioned advice of washing your hands. Washing your hands is not only the simplest, but the most effective thing we can do to stop transmission of almost any kind of deadly virus or bacteria. If you are worried about your child who's an athlete in the locker room, using the towels, using the same equipment that other kids have used, then you've got to raise the level of awareness with the child. What we've seen now is a number of schools have actually closed down so they can sanitize their schools because they've had outbreaks of MRSA. So the best thing is to cover your child's cut or scrape, whatever it is. Educate your child so that he or she washes her or his hands frequently, and make sure that any attention is paid to any unusual lesion that, again, changes and gets worse or doesn't get better.